I believe we are live. Let's check and see if we are live. Let's see here.
Checking here.
Let me see we're live. I gotta check on my cell phone all the time.
That's
Just
what I'm doing.
yeah, to see we're actually live or not. It's kind of a sad way to check technology. But
See if we are live. Oh,
oh,
I hear you.
oh yeah, I guess I'm live. Okay, very cool. We'll open this up. Cool. I guess I'm live. Good morning, Sherry. Good
There
morning,
you are.
Virginia, Barbara. Yeah, we always have to double check to see we're live because oftentimes I don't know.
Yeah, no, you're live. I'm watching you right now.
Yeah. Good morning, Paula. Good morning, Dan. This is our. We've been alternating every Wednesday and Tuesday so, with memorial care, health education. So if today is Tuesday, then I guess next week is Wednesday. And good morning, Cindy. Good morning, Twee. And so yeah, we've been alternating at 9:30 a.m. every alternating Tuesday and Wednesdays. I speak for Memorial Care medical group, and I'm one of the Memorial Care physicians here in Orange County. How many offices do we have now in Memorial Care, Jose?
Oh my gosh! So we just added another one in Irvine on Culver. So
Irvine and Culver.
28.
I
I think
lost
we have.
track.
Yeah, no, I think we have like 28, 29 locations now. And then we just recently signed a contract
Hmm.
with physical therapy.
I see.
Hold
Physical
on.
therapy group. Very cool.
Yeah,
Very cool. And so, yeah, Memorial Care has about 30 offices throughout Orange County and I think Long Beach. And
Long Beach,
so
one in Torrance.
one in Torrance. Okay, I guess we're going more north,
And
huh?
well, we're trying. Another, you know what's we just added a new service actually. So we're offering pharmacy at our locations now through Spot RX. So it's very, I mean, technology these days is
Convenient.
amazing. So it's a vending machine that it's at our medical facilities
Hmm.
that, I mean, those vending machines have over 600 medications. They are stocked with
Wow.
the most common prescriptions that the doctors prescribed
Hmm.
at their location.
Hmm.
But if for some reason your medication is not that office, they'll do
Hmm.
same day delivery.
Wow. So same day delivery of medications now. Is there a cost to
Yep.
it or not really?
No cost at all. As long
Wow.
as your prescription, depending on the health plan you're on,
Yeah.
and their formulary, that'll be the cost. But there's no cost for same day delivery. No cost if you use that SpotRx service at our
Hmm.
location through the vending machine.
Hmm.
It's just it's another way of making more convenient to our members.
Wow. Okay. That's pretty cool. The so let's talk real quick about inflammation that I wanted to chat with you guys today. And the reason I want to chat specifically about inflammation, and this has been an ongoing theme the last few years as we are learning about the how inflammation affects every system in your body, and it also affects coronavirus infections as well. Some of you may or may not already know that one of the reasons COVID kills is is that it attacks a weakness in our body, whether we have diabetes or hypertension or any weak parts, any immune suppression areas that we may have simply because we're either getting a little bit older or because our nutrition and diet does not promote health. We have often noticed that if you have existing conditions that predisposes you to having inflammatory disorders, it is not good for for first of all general health including conditions like cancer or Alzheimer's or heart disease and things of that sort. But it also predisposes you to having problems when you get infections. And that includes coronavirus infections as well with that. And I want to chat with you because I want to ask you a question. Is inflammation something you can feel or cannot feel? Right? Is inflammation something that you can feel internally that's there, or you cannot feel and is silent, right?
It's silent.
Right? Yeah. A lot of times it is silent. Good morning, Sophia, Jen. Good morning. And so sometimes you can feel inflammation. I mean, if you have arthritis, right? If you have arthritis, you can feel that. That's inflammation, right? If you if you get sick and you have a fever, that's inflammation, right? Did you know that a fever from having the flu virus is simply inflammation? That's all it is, right? It's when your immune system's attacking the flu virus, and during this battle between your immune system, and a virus, whether it's the flu virus, coronavirus, or a bacteria, or some toxin, right? Oftentimes during this battle, you get a fever, which suggests you have an infection, and that is simply inflammation. Inflammation is a fever, right? So sometimes you can feel inflammation. Arthritis, you can feel inflammation. Most of the time, you can have underlying inflammation and there's no feelings. You don't feel anything different with that. You feel normal, but your body is internally inflamed. Do you guys know of a blood test that looks at inflammation? Good morning, Yvonne. How are you? Do you guys?
The creatine kinase.
It's creatine kinase, CPK, comes from the muscle. And so inflammation of your muscle can elevate that, yes. But if your muscles were not inflamed, what other blood tests can be checked to look for internal inflammation? Does anyone know? If you know, type it in the chat box. If you know, type it in the chat box. There are other blood tests that can be checked to look for internal inflammation. Sherry Ross says MCV. MCV stands for mean corpuscle volume. That's actually not an inflammatory marker. That is a marker to look at the shape of your red blood cell. Cindy says protein. The protein level doesn't necessarily look at inflammation. This is like Jeopardy, guys. It's like Jeopardy. Anyone need a lifeline to call? Does anyone know the name of the blood test or two blood tests that looks for inflammation specifically? So, answer number one is the sedimentation rate. Sed rate. Have you guys heard of the sed rate before in a lab test? It's sed rate, sedimentation rate. So I'll type it down here in our chat box for you guys. SED, and this can be checked in the blood. There you go, sed rate. Sherry says platelets. Elevated platelets can sometimes indicate inflammation, yes. But the sed rate or the sedimentation rate can look for inflammation. The second blood marker that looks for inflammation is called and I'm going to type it down for you guys here in the chat box, the CRP level. CRP level, guys, also looks at inflammation. CRP stands for C-reactive protein. C-reactive protein. That is also a marker for inflammation. Okay, so those two tests can be checked in the blood test to see if you have internal inflammation or not with that, if that's an interest of yours. The question is, what do you do with those results, right? If you check and your CRP level is high, what can you do with it? There are many things that can cause an elevated CRP level. Sometimes it's non-specific. But if you had an infection, that may raise your CRP level. Any infection can cause inflammation. If you had an internal infection, that can be a cause. Um, if you had, but but the reason you would want to check for inflammation is because you want to find out the cause of this inflammation. Is it something that we're missing, right? Is it something in our diet, in our nutrition? Is it an infection? Is it a toxin? You want to find out the cause of uh, of inflammation and to address that. Because oftentimes we may walk around with internal inflammation, guys, and never feel it because we may feel completely normal until we look for it, right? And when we look for it and we notice that these levels are high, then it'll be a good reason to search for it uh, because inflammation is a silent killer that we may not realize. Inflammation is driven or is a driver of many chronic diseases. If you think about the different organ systems in your body, if you think about the different organ systems in your body and the diseases that stem from these organ systems, oftentimes we can link inflammation to it. For example, let's pick I don't know the lungs, right? The pulmonary system, which is an organ system, right? Some of the diagnosis from having lung problems could include like I don't know, emphysema, right? Emphysema is a inflammatory disorder. Emphysema or COPD, COPD exacerbation is when you have inflammation of the alveoli sacs of your lungs. So that's linked to inflammation. Asthma is simply an inflammatory disorder as well. Asthma is when your immune system doesn't like something that it's been exposed to, and so it it attacks. Like I don't know if you were allergic to like cold air, we call that cold-induced asthma. If you're allergic to physical exertion, we call that exercise-induced asthma. If you're allergic to like a perfume, right, then it's a chemical that induces the asthma. Basically, the immune system doesn't like those things. So when it is exposed to it, it creates inflammation, which causes mucus production in your lungs, in your bronchial tubes, which causes you to start wheezing, right? So wheezing is simply a symptom of inflammation from asthma, right, or from COPD. Are you seeing how I'm linking certain diagnoses to the lungs? But when you think about it, that's just one theme behind it, and that one theme is inflammation. Um, Other lung conditions could be bronchitis, right? So bronchitis is simply inflammation of the bronchial tubes. So all kinds of different conditions of the lungs and one theme, which is simply inflammation. And I can do that with other organ systems in your body, right? Let's say, for example, the GI system. The GI system, acid reflux is simply, or heartburns is simply inflammation of your stomach or your esophagus from too much acid. So that's inflammatory induced as well, or causes inflammation, right? Have you heard of Crohn's disease? Crohn's disease is simply inflammation of your intestines. Have you heard of ulcerative colitis? Ulcerative colitis is simply inflammation of your colon. Are you seeing a theme here, right? Type in yes if you're seeing a theme here between the different diagnoses that we're talking about so far and how it's all kind of linked to inflammation. Pretty crazy, isn't it? With that. Other GI conditions, pancreatitis is simply inflammation of your pancreas. Hepatitis is inflammation of your liver, right? So the GI system, I've named several different conditions, guys. I've linked it all to inflammation with that. Gluten sensitivity is simply inflammation, right? From being exposed to gluten, the GI tract does not like it. The immune system does not like it. So it attacks these different, gluten or wheat or whatever it is, and you get inflammation as a result of that. With that, Sherry says, I picked up an infection while traveling, bacterial overgrowth. I had to take an anti-inflammatory. Yes, yes. So bacterial infections, bacterial overgrowth leads to the immune system attacking the bacteria, which leads to inflammation as the result of the immune system fighting bacteria, right? Inflammation is created, and it causes just not good things, right? So simply from the GI conditions, all the different diagnoses I've given of GI problems are inflammatory conditions.
Dr. Trent, quick
Yes.
question for you.
Yes.
If you have any of those conditions, and I mean, God forbid, but if you end up getting the coronavirus, are you more at risk because you have one of those conditions?
Yes.
Does it inflammation get worse, or?
Yes, you are at risk. If you have inflammation, if you have underlying inflammation, and you throw inflammation from coronavirus on top of that, right? It overwhelms your body. In coronavirus, there's a condition that we call the cytokine storm. Cytokine storm is basically an inflammatory overreaction, often in your lungs, where your immune system is trying to fight the virus that's in the lungs. So as it's attacking the coronavirus in your lungs, it's creating all this inflammation in your lungs, and the inflammation itself is what kills you, which is why dexamethasone is a FDA-approved medication to be given to coronavirus patients in the severe stages in the hospital to improve mortality, right? It lowers death, and dexamethasone is simply a steroid to cut down inflammation that's going on in your lungs as a result of coronavirus. That's why dexamethasone is approved. It stops inflammation in the lungs. So that's the underlying reason behind it. You've heard in the news that obesity is a risk factor for coronavirus. Folks who are overweight, right, have a higher mortality rate. They don't do as well when they get coronavirus. And the question is, why does being heavy put you at risk for coronavirus, right? Or why does being overweight put you at risk for coronavirus? And I'm going to share something with you to link that story together. Why being overweight puts you at risk of dying from coronavirus. With that, so let me link the whole story behind that, and you'll completely understand why that is. Doesn't steroid decrease immunity? Cindy, yes, the steroid can suppress immunity. So there is a balance. There is a balance of when to use steroids. Because using steroids at the wrong time can suppress your immune system from fighting coronavirus. But using steroids at the right time can suppress the inflammation, the overreaction of inflammation that's in your lungs that can kill you from coronavirus. So you can't really say that, you can't really give a blanket statement, right? So it has to be used at the right time, at the right situation for coronavirus, which is why I get really worried when people go on Facebook and they're like, this is going to cure this is going to cure that, because these are all medications with side effects. Plaquenil has side effects. Did you know that? Hydroxychloroquine, the famous hydroxychloroquine, it has medication to medication interactions that people are like, everyone wants Plaquenil, but did you know how Plaquenil can interact with the other medications you take, right? Because it does. There's nothing that's completely safe. You need to use it at the right indications, and that includes coronavirus indications and timing and things of that sort. But let me tell you, let me link something that's really interesting. We know that sugar is pro-inflammatory. We know that sugar promotes inflammation. Here's why. When you have so much sugar in your bloodstream, the sugar is floating around. And by the way, when I talk about sugar, guys, I'm not talking about candy, cookies, ice cream, and all that stuff, right? I'm really talking about the American diet. I'm talking about the breads, the pasta, the rice, the tortillas, the spaghetti. I'm really talking about the American diet, right? Because that stuff breaks down to sugar, right? The carbs that we eat breaks down to sugar, and and what happens is that the sugar, so much sugar is floating around in your bloodstream, and as sugar is floating around in your bloodstream, the sugar attaches itself. It binds, right? The sugar binds to other things that are floating around the bloodstream. So the question is, what else is floating around in your bloodstream? You got proteins floating around in your bloodstream. You got molecules floating around. You got blood cells, red blood cells floating around. You got white blood cells floating around, which is your immune system. So all these different things are floating around. So all this sugar that's floating around, it attaches itself. It attaches itself to the other proteins floating around. So what we see is we see a we see a protein that has a sugar tail, right? That has a sugar tail that's attached to the protein floating around because the sugar is hitchhiking, right? The sugar is hitchhiking on these proteins. We have a name for these sugar tails. Does anyone know the name of the sugar tails, right? Does anyone know the name of the sugar tails that we have? We all have sugar tails floating around. I'm going to type down the name for you guys here. Um, and so you can look it up. You can Google it. Okay. The sugar tails is called advanced glycation end products. Real long, right? I typed it in the chat box on Facebook for you. Advanced glycation end products. That simply means sugar tails. And if you were to copy those long words, advanced glycation end product, paste it on Google, do a Google search on it, on advanced glycation end products. And what they are is they're sugar tails. Wikipedia will pop up, and the end of all truths, right? Wikipedia tells you everything, and so you'll notice that on Wikipedia, you'll notice that these sugar tails, these advanced glycation end products, is the cause behind aging. It is the cause behind why we get older, and it's also a cause behind chronic diseases. It promotes chronic diseases like the heart disease, the diabetes, hypertension, these chronic diseases, right? So they're all linked to these sugar tails. And the question is, why is that? How are these sugar tails all linked to aging and chronic diseases? The first thing you should know is that aging is a process that occurs from inflammation. Aging is an inflammatory process. It is pro-oxidation of what we call it oxygen radicals and things of that sort that drives aging, right? Pro-inflammation process that drives aging. And so the question is, how are these sugar tails related to that? And here's what happens. You have these sugar tails, right? These advanced glycation end products floating around in the bloodstream. And the immune system, which is designed to protect you, and the immune system is designed to find anything it does not recognize. And if it doesn't recognize it, that thing is a threat to the body, right? A virus, a bacteria, a mold, a toxin. So the immune system sitting there in your bloodstream and it's looking and it's like, what are these things with sugar tails attached to it? Right? What are these sugar tails? I don't recognize what those are. I don't know what those are, right? So the immune system may have recognized the original protein that's floating around, but the original protein has now changed, right? It's changed shape and size because it now has a sugar tail on it because of too much sugar in your bloodstream, right? It's attached to it. So the immune system doesn't recognize the sugar tail. And what does the immune system do, guys, if it doesn't recognize something? Right? What does the immune system do to it? Right? Type down in the chat box. What does the immune system do to it if it doesn't recognize something? Right? The immune system will attack it. That's right. That's right. The immune system will attack it. And in the process of the immune system attacking and fighting these sugar tails, in the process of this battle between the immune system and the sugar tails, what is created, guys? What is created in that process? Does anyone know? Right? Type down in the chat box. What is created in that process with that? That's correct. Inflammation. Kapow. Right? Inflammation is created. So this is the link between our diet, our nutrition, sugar tails, inflammation that results from the immune system attacking our own body, silent inflammation that you cannot feel, right? Silent inflammation. That's right, Tui. That's right, Cindy. You're correct. Silent inflammation. That's right, Sherry. Silent inflammation that we cannot feel internally. This inflammation occurs daily. Why does it occur daily? Because the American diet is a daily diet, full of carbs, full of sugar, which creates a lot of sugar tails. Now, are you guys getting this so far? How inflammation is the silent killer? Are you guys understanding so far how inflammation is a silent killer? I want to connect all this to you guys because it's, it's something you should learn about because obviously your doctor doesn't talk about it in the office, do they? So Twee says, how does this relate to obesity? So, when you have too much sugar, good morning, John Gutierrez. OC Hospice is present. John Gutierrez from OC Hospice. Good morning, John. With that, they're a pretty awesome organization, by the way, OC Hospice. With that, so how does this relate to obesity? So listen up, John Gutierrez. So you don't get obese, right? Not that you are. So listen up. This relates to sugar and diabetes and everything else as well. When there's too much sugar in your system, that sugar needs to go somewhere. It needs to deposit somewhere in our body, right? It needs to deposit somewhere in our body. The first place that sugar goes to, guys, is your liver. It deposits in your liver and it creates a condition called fatty liver. Have anyone heard of fatty liver before? Type in yes if you heard of fatty liver before or no if you haven't with that. Okay, yes, right, excellent. Yes, John Gutierrez says he lost 17 pounds when he cuts out sugar in a month. 17 pounds, John, that's pretty good, right? Vicky says, I get it, but why do we crave carb and sugar? Yes. I'm going to explain to you guys why John Gutierrez lost 17 pounds. Yes, Vivian. Awesome. Sherry, yes. So I'm going to explain to you guys why John Gutierrez lost 70 pounds when he cut out sugar. When there's too much sugar, the first place that sugar goes to is the liver, causes fatty liver. Fatty liver causes this hepatitis that occurs in your liver that leads, if not treated correctly, fatty liver will lead to hepatitis, which is what it causes. You'll see an inflamed liver from your liver enzymes being high. That can lead, if not treated, to cirrhosis over time and liver transplants. And so not good stuff, right? Too much sugar in the liver is fatty liver. That's all it is. Now, the second place that sugar goes to, guys, when there's too much sugar is that it goes and it deposits in your fat cells. When there's too much sugar, it goes and it deposits into your fat cells and it makes us fat. Simple. Did you know that 2 out of 3 Americans are overweight? 2 out of 3 of us are overweight based on the BMI index, right? That's the body mass index. 2 out of 3 of us are overweight. Sherry says, how do you check liver enzymes? It's a simple blood test, Sherry. And on the blood test, you look at the ALT level and the AST level. Those are both your liver enzymes. The total bilirubin is also part of your liver enzymes as well, right? So that's how you look. So 2 out of 3 Americans are overweight based on the BMI index. And forever we have been taught that if you're overweight, if you want to lose fat, right? If you're fat and you want to lose fat, we have all been taught that you need to be on a low fat diet, right? You got to be on a low fat diet is what we've been taught. And I get that, right? If you're eating a steak and there's fat around the rim of the steak, what do you do to that steak, right? What do you do to the fat? If you're eating a steak and there's fat around the rim, what do you do to that steak or to the fat? Type in what you do to that, right? What do you guys do when you're eating fat and there's fat around the rim? Eat it? Somebody says just eat it. All right, perfect, right? Well, okay, you can eat it, but many of us trim around it, right? Many of us trim the fat around the steak and we set aside the fat because we don't want to get fat, right? So we cut the fat out. And that's how we've been all trained to cut the fat out, right? If we see fat, we've all been trained to cut the fat out. And we all do it regularly. And let me ask you this. If we are all cutting the fat out of our steak, if we're all trimming the fat out, Twee is going to eat it. Cindy is going to eat it. Oh my word. Okay. I love this audience. This is the audience that eat the fat on their steak. So, all right. So Vicky's gonna cut it out, but Twee and Cindy's gonna eat the fat. So anyway, I bet you that Twee and Cindy are probably Skinny Bone Jones while they eat all their fat, right? Good morning, Jen. And so if we're all trimming the fat out of our steak, why is it that 2 out of 3 Americans are overweight? Right? If we're all trimming fat out of our steak, why is it that 2 out of 3 Americans are overweight? Right? 2 out of 3 Americans are overweight, guys, because it's not the fat, it's the sugar. 2 out of 3 Americans are overweight because it's not the fat, it is the sugar. The too much sugar deposits into your fat cells and makes us fat. Does that make sense? Sugar is the Trojan horse behind obesity. Sugar is the Trojan horse behind obesity. And when I talk about sugar, I'm talking about the American diet. I'm talking about, right, white bread, white rice, pasta, pizza, spaghetti, right? Tortillas. I'm talking about the American diet. This is why 2 out of 3 Americans are overweight. It's not about the fat. It is the American diet, which is carbohydrate loaded, which becomes sugar, and sugar goes into your fat cells. So what I'm saying is this. I'm not saying to eat all the fat you want, because there's good fat and then there's bad fat, right? The saturated fat is not good. The trans fat is not good, right? The good fat would be like, I don't know, like olive oil or nuts or fish is good fats, right? So we need fats. We need fats. We need the good fats, not the bad fats. So what I'm saying is that I have linked for you sugar and sugar tails that lead to inflammation, right? Sugar creates sugar tails. The immune system attack the sugar tails and it leads to inflammation. Sugar, too much sugar, also leads to obesity. Are you understanding so far? Are you following me so far? Sugar causes inflammation from sugar tails. Sugar causes obesity because too much sugar goes into your fat cells and cause obesity. Okay? Are you following me so far? Type yes if you are. Between obesity and sugar tails and all that. Type yes if you're following me. I don't want to lose anyone here with that. All right? So the conclusion you should draw is this. The conclusion you should draw is that obesity is simply a symptom of inflammation. Obesity is an inflammatory disorder, which is why patients who are obese have a higher death rate with coronavirus. Does that make sense? Obesity is an inflammatory disorder. That's what you should know. So, if you want to lower inflammation, you need a lifestyle that will allow you to get rid of obesity. Obesity is simply an inflammatory disorder because sugar drives obesity, sugar drives the protein tails, right? Advanced glycation end products. Sugar drives both. So although you may not see the sugar tails floating around, although you may not feel the sugar tails floating around, right? If you're on the overweight side, you can bet that there's sugar tails floating around because sugar drives both. So what is the solution to this, guys? Right? John Gutierrez gave you the solution. He cut out sugar and lost 17 pounds as a result. And that's the same way you're going to cut out inflammation as well, guys, with that. Good morning, Christine. And what is Christine saying here? Thanks for sharing. I would love to connect with you regarding an hour-long virtual event for a private college in Orange. Christine, sure, just send me a message on Facebook and we can chat, right? I do a lot of these virtual chats all the time. I think at 11 o'clock, I'm doing another chat with another organization later on as well. So yeah, send me a message. Good morning, Virginia. So guys, do you see the link on how inflammation is a silent killer? You may not feel the inflammation unless you have arthritis. You may not see the inflammation. You can't see sugar tails floating around, right? It is a silent killer, guys. It is a silent killer. But that's how, it's all linked together. And that's why patients who are obese or overweight are at higher risk, right? Are at higher risk for coronavirus death. Now you know why, right? It's not simply because you're overweight, so corona's going to get you. It's really because obesity is a sign of too much sugar that's being fed into your fat cells, and the sugar also feeds the inflammation, guys. With that, the sugar feeds the inflammation, and the inflammation is what kills you because coronavirus right? And it's fighting the immune system, and the immune system overattacks it and creates inflammation. And if you have underlying inflammation on top of extra inflammation in your lungs, right, you get coronavirus death as a result of that. All right, guys. I hope this is helpful for you guys. This is today's lecture for today, and how do you stop inflammation? The best way to stop inflammation, guys. Sherry says, what if you're skinny with inflammatory disorder? Yes, same risks, anything that causes inflammation. The steroid leaves sugar tails. Steroids, long-term use of steroids increases your blood sugar, which is not good. Long-term uses of steroids, unless you really need it for your health, I wouldn't recommend it. But short-term steroid use, a few days, a week, no big deal, Cindy. I'm not so concerned with that. I'm more concerned if you had long-term use of steroids, right? But obviously, there are health conditions where people need to take steroids long-term with that. All right, Jose, any other thoughts before we close?
No, Dr. Trim. I mean, it's amazing. I'm definitely going to cut sugars today.
Starting today.
And it's our daily habit and routine. Like you said, we were brought up with having 3-4 meals a day and snacks in between. And the result of that is that, yeah, I mean, 2 out of 3 Americans are they're overweight because of that.
Yes.
So it's hard to break that cycle, but it's how you want to live. Down the road, and
right. Yeah, I totally hear you. And with this, why we go out and we do these lectures, right? Why I'm so passionate to let people know about this, because there's not enough time in the doctor's office for your doctor to educate you on all these things. So I take it outside of the doctor's office, and we go on Facebook Live to educate. So
yeah, thank you so much, Dr. Trin. Thank you so much for all the support and everything you do, not only here but around the world, different countries. So you're an amazing human being, Dr. Trin. Thank you.
Sure, I'll pay you later, Jose, to say that. Thank you. Thank you.
Come on.
I'm just kidding, guys. All right, so we're on next week again. Is it going to be next Wednesday?
So it'll be Wednesday, September 9th, and that's leaky gut syndrome. And that's a really good health lecture.
Next week, guys, we're going to talk about leaky gut syndrome. Wednesday at 9:30 here on Health Talks with Dr. Trin. Sponsored by Memorial Care, so which is cool.
Thank you so much.
So
appreciate the Dr. Trin.
All right, I'll see you guys later.
All right, my friend. You take care.
Take care, everyone. Bye-bye.
Bye, everyone.